Autism spectrum disorder is a developmental disorder involving a wide range of behavioral and communication factors. While the exact cause of this disorder is unknown, a diagnosis often takes place in a multidisciplinary setting. Dr. Lisa Bergeron explains.
The heart of autism is difficulty with language, difficulty with social communication, and then some repetitive stereotypical behaviors and some sensory processing difficulties. So many times we see that there can be a speech and language therapist that may have concerns about autism in a child, an occupational therapist that may have concerns about autism in a child, as well as the primary care provider. Typically, when a child needs to have more formal diagnosis for autism, they're going to see a developmental pediatrician, they may see a neuropsychologist in order to kind of get more to the heart of what's going on with the child.
What are some of the most common risk factors for autism spectrum disorder?
Boys are about 4 to 5 times more likely to have autism than girls. Recent research, according to the Center for Disease Control, is that we see 1 in 37 boys affected by autism. 1 in 151 girls are affected by autism. So gender is a big risk factor. We also see that genetics plays a role in autism. If a family has one child with autism, we'll typically see that there is somewhere between a 16 to 20% chance of having another child with autism. There's some research that also shows advanced maternal age may be a risk factor for autism as well. I think one of the most important things for me to convey to families, though, is that vaccines are not a risk factor for the development of autism.
Understanding the needs of a child with autism spectrum disorder can be especially challenging for parents. But according to Dr. Bergeron, early detection plays a vital role in outcomes.
When a child has autism, sometimes it is very difficult to determine what they are thinking or what they are feeling, because many times they do not have the ability to verbally communicate that with others. So much of the time, parents, caregivers are unsure about what's going on in the mind of a child with autism. So it makes it very difficult, challenging, and frustrating for the child and the parent. And this is the reason why it is so important to address the needs of the family and the child whenever there's a concern about autism.
Upon receiving a diagnosis, Dr. Bergeron recommends seeking early intervention and discussing available resources with a primary care physician.
I know receiving a diagnosis of autism for your child can be very difficult, and I applaud parents when they take the initiative and know something is not going quite right and we need to know what to do to help the child, because it helps the child and the family. And it is so important, again, to look at the whole picture. And if your child has autism, again, like I said, it's an impactful diagnosis, but it's important to remember it's your child. You're going to love them no matter what. And if you get them that help that they need or help and support that families need, it will become so much better for all those involved.
This has been Making the Rounds, brought to you by Parkview Health.